Assalamu alaikum and a very good morning to everyone present here. I am Dr. Mohammad Nafi Taslim. I'm working as a medical officer at Breast Care Unit by Dr. S.K. Farid Ahmed in Japan, Bangladesh Friendship Hospital. My topic of conversation today is single incision breast conserving surgery with axillary sentinel lymph node biopsy or clearance. And the question that we're asking today is it a feasible option with higher patient satisfaction? With the motto that minimal invasive surgery, better cosmesis, higher patient satisfaction, with the firm belief that less is more. So let's start with what is single incision breast conserving surgery. Single incision breast conserving surgery uses a single incision to take out the cancerous lump, and it includes axillary nodal dissection through the same incision. It has been widely practiced in first world countries since 2019, and it showed a similar outcome in terms of breast tumor margin clearance and axillary lymph node sampling compared to double incision with greater cosmetic and patient satisfaction. What are the challenges that face single incision breast conserving surgery? Firstly, it is ensuring a complete margin clearance when excising the breast tumor. Secondly, it is achieving optimum axillary nodal sampling through sentinel lymph node biopsy or axillary node clearance. And then it is to reduce post-operative complications and ensure a short duration of hospital stay. And last of all is to reduce the wound infection and ensure good cosmetic outcome for the patient. And overview of what our study focused on. 60 patients who underwent single incision breast conserving surgery with axillary nodal staging were retrospectively studied from June 2019 to October 2024 in our electronic software. We looked at the oncological safety of single incision breast conserving surgery and axillary node surgery with post-operative complications, patient satisfaction, and we tried to understand the feasibility of this method. How did we ensure oncological safety for single incision breast conserving surgery? We used frozen section in this case to ensure that the margins were cleared after surgery with more than 1 millimeter in all cases. 7 patients underwent wire-guided wide local excision and the rest underwent wide local excision of breast lump. For axillary surgery, we use sentinel lymph node biopsy with dual tracker technique and axillary node clearance. In one incidence, a total of 21 lymph nodes were removed, of which 19 came out to be positive. From the chart, we can see that 33% underwent axillary lymph node clearance and 66.7% underwent sentinel lymph node biopsy in our center. Now, what is the surgical method for single incision breast conserving surgery? First and foremost, it is histopathological confirmation of the breast cancer through use of core biopsy and immunohistochemistry. On the day of surgery, we marked the site of breast tumor, ensuring that there was proper access to the axilla. When analyzing this, we found that most of the tumors located in upper outer quadrant, making up for 78.3%, were good candidates for single incision breast conserving surgery. And for lower outer quadrant, it came out at 21.7% of the patients being a good candidate for this surgical method. In case of single incision, in case of sentinel lymph node biopsy, dual marker technique was used using 2 dyes to identify the first line lymph nodes. In this case, more than 3 lymph nodes were dissected out. And for axillary clearance, a maximum of 10 lymph nodes are to be isolated while preserving important axillary structures like the thoracodorsal bundle, long thoracic nerve, and a drain tube and the axillary vein, with a drain tube being left in situ. Here we can see a patient with immediately after the surgery who underwent single incision, and an ANC was done, and we can see the drain tube placed in situ. Wound was closed in the following steps. Level 1 oncoplasty was done to maintain aesthetics. Wound opposed by 3-0 suture, and the wound closed with subcuticular stitching. Skin glue was applied on top together with skin tape to ensure proper waterproofing and reduce the chances of infection. Here we can see a picture taken immediately after the surgery, after applying all the tapes and glues, and we will be reviewing this patient again at 7 post-operative day for any signs of infection. Now, coming to infection and post-operative recovery. All the patients at our center were discharged the following day after surgery, of which we could see that 2 patients had an infection, which was characterized by tenderness and erythema on 7th post-operative day, and 58 patients had recovered uneventfully. Of the patients who suffered infections, they were treated with extended oral antibiotic for further 7 days, but no admissions were required. Now, coming to the most important topic, patient satisfaction. Single incision breast conserving surgery provides decreased pain in the operative side in case there is decreased lymphedema, and it provides better cosmesis, which provides a significantly better patient satisfaction. It builds patients' confidence when they're recovering from a disease such as breast cancer, and it encourages the patient for faster recovery. It provides them a smoother transition to daily routine and a better conjugal life. Now, what is the future of single incision breast conserving surgery? With proper training facilities for younger surgeons, single incision breast conserving surgery could be practiced more widely in this part of the world, and it would ensure better care for our patients. Since the motto of this year's conference is collaboration, through collaborative efforts, we believe that younger surgeons could very well perform single incision breast conserving surgery while keeping oncological safety and patient cosmesis in mind, and bridge the gap between patients' outcome in SAARC countries and the rest of the Western world. Here we can see two pictures. One is at the 7th postoperative day where the skin tape is still applied, and the other is on the 14th postoperative day where we have removed the brown tape and we can see that the wound is healing well. Okay, so the two pictures, one is at 7th postoperative day and the other is 1 year post-surgery. So in 1 year post-surgery, we can see that there is very minimal scarring. In fact, if we concentrate, we can see just one single incision at the upper outer quadrant through which we did the breast surgery and axillary staging as well. These are some references, and I would like to thank all the audience for their attention. Thank you.